Hello, my name is Devin Robinson, and today I will talk about the University of Scranton's drug and behavior summer class outline on chapter 8. So for this outline, for this chapter, it dealt with different mental disorders and psychiatric medicines use and drugs use. So all the mental disorders are classified by the DSM-5, which is the psychological book, which classifies all different types of mental disorders approved by the APA. Then we then move on to anxiety disorders, which are basically mental disorders which are classified by excessive worry, fears, or avoidance. Some examples that we will go into are like specific phobias, which is excessive fear over a specific object or situation, social anxiety disorder, which is a social phobia marked by the fear or anxiety of different social situations, panic disorders, which is recurrent and unexpected panic attacks causing intense fear or discomfort. Agoraphobia, which is fear of public transportation. It's like two or more of these listed. Public transportation, being in open spaces, being in shops or theaters, standing in line, or being outside of home alone in general. Then we have the last anxiety disorder we would be mentioning in class is the generalized anxiety disorder, which is an anxiety disorder about events or activities such as work, financials, school, that kind of anxiety that may be provoked. Then we moved on to schizophrenia, which is basically delusions, hallucinations, disorganized speech, grossly disorganized behavior, or negative symptoms, and negative meaning the absence of symptoms. And this would have to be going on for at least 6 months before it's classified as schizophrenia. And then we have treatment methods. First, we would talk about before the 1950s, there was the crisis therapy, which basically used barbiturates to relax the person, and then use psychotherapy, which we talked about in the last chapter about with regarding barbiturates and psychotherapy. And then they also had electroconvulsive therapy, ECT, which is shock therapy, which is used to cause seizures in the brain, to correct different like depressive disorders. Then we have antipsychotic medicines, which these are used to treat psychosis, which is major mental illnesses, such as like schizophrenia or depression. The advantage to these is the drugs that are used do not produce dependence, and it's very hard to commit suicide with. So that's good for if somebody was like mentally unstable. You don't want them to get like addicted to another drug to add on to another problem. And then if they're also mentally unstable, they could have a risk of committing suicide. So that's also an advantage. Then antidepressants, which help with depression. We have the 3 different types, the monoamine oxidase inhibitors, which are used to inhibit different neurotransmitters such as dopamine, norepinephrine, and serotonin. And we have tricyclic antidepressants, which are named because they have the structure of the drug is 3 rings. And then we have selective serotonin reuptake inhibitors, which are antidepressants which block the reuptake of serotonin in the brain. And then this is a graph showing the amount of people in non-federal psychiatric hospitals. And you can see that it starts out really high in like the 50s, but then it very sharply goes down to not having that many. And then a reason of this being seen is that it's becoming increasingly apparent that there are people who have mental disorders who are going straight to prison rather than going to the psychiatric hospitals. And that concludes this day's outline, and have a good day.